correct?
Yes, sir. Yes, sir.
I just went back to the original arrow because that helps me better.
All right, no problem, sir. This is also
Three,
visible. Yes.
2, 1. We are live now, ma'am.
So, a very good afternoon to all the viewers of BoneFit Live. So, today we have gathered to discuss about a very important topic, that is robotics in knee surgery. So, robotics in is actually a very advanced technique where the orthopedic surgeon uses the help of robotics for performing surgery on the knee with very high precision. So, without further ado, to enlighten us further on this particular topic, I take privilege in welcoming Dr. Pranav Agarwal, sir. Sir is consultant orthopedic surgeon at Fortis Hospital, Mulund, and Leelavati Hospital and Research Center. So, sir will guide us today all about this very important and relevant topic, especially if you have elderly parents or you yourself are an elderly patient. So, over to you, sir.
Thank you so much, Dr. Kajal. Good afternoon, ladies and gentlemen. I'm Dr. Pranav Agrawal. Can you hear me very clearly, Kajal? Is everybody in sync with my voice and my screen?
Yes, sir. Yes, sir.
Thank you so much.
Yeah.
Good afternoon again, everyone. I'm Dr. Pranav Agrawal. Let me begin by saying that we live in the year 2025. And while the talk of the town circulates around artificial intelligence and robotics and sending missions to the Mars and Moon and satellites and warfare and whatnot, we are very, very, very forward in technology in all sorts of fields. But today, I take the privilege of talking about something which is very important to everyone, which has been important for many, many years. And I'm going to talk today about magic. Yes, we are talking about magic. Let me talk about this. Let me explain to you how this thing works. Let's look at this screen. On the left side of the screen, you see this gentleman holding a tray. He is one of the best chefs the world has ever known. He's a Japanese chef. Look at the beautiful platter on his plate. This guy is extremely accurate. This guy is extremely well versed with his art, with his craft, and people would love to go and see him eat from his hands. And it takes sometimes months to get an appointment at his restaurant and eat from him. But today, look at the image which is there on the right. He has been replaced by a robot. And Japan and such other places are proud of this achievement where they have replaced an already great chef with a robot. Let us talk about magic. Let us look at that image which is there over here. Can anybody tell me what this image is? Yes, this image is from great Indian mythology. This is the Pushpak Viman. Now, our sadhus and sons and our priests who wrote some beautiful mythology in those times had never seen an aircraft. At least we assume that they had never seen an aircraft. Then, how is it that they spoke about an aircraft? It's because they thought at that time that this was magic, that there were people who could fly, there were kings who could fly and who could go from one place to another very fast. Little did they know that many, many centuries down the line, many, many thousands of years down the line, there will be an actual aircraft which will fly people from one place to another. So, what they thought was magic once upon a time is today's reality. And in words of Sir Arthur Clarke, any sufficiently advanced technology is indistinguishable from magic. Today, when we think about some of the most beautiful novels written by some of the greatest authors. For example, Jurassic Park. Now, these are fiction, but one day the fiction will turn into reality. Today, we are sending people to the moon, we are sending people to the Mars, we are landing on the wrong side of the moon, we are doing everything. And that is because of technology, but it used to be magic once upon a time. I'm Dr. Pranav Agrawal. I specialize in surgery of the knee. I do robotic joint replacements for my patients. I do arthroscopic ligament procedures, particularly for patients who have sports related injuries like ACL tears and meniscus repairs. I treat fractures as well, and I correct a lot of deformities. I'm the section editor for orthopedic surgery of the Indian Practitioner, and I have a good 8 or 9 publications in internationally reputed journals. I'm also a Rotarian, and I feel that it is important that, irrespective of technology and whatever we have, it is important that we give back to society. And I do that through the ages of Rotary Club of Mumbai Coastline and Rotary International. This is where I work. This is the prestigious Lilavati Hospital and Research Center in Bandra and the Fortis Hospital in Mulund. These are my two primary centers. We have access to robots over here. I also work at many hospitals in the western suburbs. That includes the Bharatiya Arogyanathi Hospital and the Criticare hospitals. I take care of a lot of patients at all these hospitals, and sometimes my patients don't just come from the next street; they come from the next state, next country, next continent. Let's discuss about this magic. Look at this. We are discussing uh, two different x-rays. This is an x-ray on the left of normal knees, and this is an x-ray on the right of what is called as osteoarthritis of knee, arthritic knees. When you see this x-ray, this is the thigh bone. This one, this W-shaped bone is the thigh bone, and this bone is the leg bone. Between the thigh bone and leg bone, there should have been a beautiful gap like this. See, it's a nearly parallel gap, nicely seen. Similarly, on the other leg, this is the patient's left leg. This is the patient's right leg. Now look at the same image on the right side. This is an X-ray of patients with arthritic knees. If you see, this is the thigh bone, this is the leg bone, and between the two bones, there is no gap at all. The bone is touching the other bone, not just here, but almost touching over here as well. This happens because the cartilage, which is between two bones, gets eroded with time. The cartilage is something like the grip of a cricket bat. If you've seen a cricket bat or a badminton racket, it has a soft grip. Now, if you've seen that racket without the grip, you will understand what it means to have bare bones, bones without cartilage. Apart from that, there are these extra bones which are formed here and here and here, what are called as osteophytes. This knee should have been aligned like this knee, but because the space over here has gone away, because of this, this knee is crooked in this way, whereas this knee is crooked in this way. So the knees are not like this, they are like this and like this, what we call as windswept deformity in this particular patient. This is an image. This is how bad an osteoarthritic knee can look, and it can give tremendous pain. We see that more frequently in younger patients today, but it's very clearly seen in elderly patients who will eventually require surgery. But the reason why a patient comes to me is because pain is what bothers them. But deformity is a 50% partner of the problem. Let me explain. These are the symptoms of the patient, which means the patient will feel this. They will feel pain. They will notice that, recently my mom or my dad has not been able to walk straight. They are rocking when they walk. They are rocking, they are limping, they are not being able to walk straight. Oftentimes, a patient will also notice it, that they are rocking when they're walking, their gait is unstable. So, difficulty to walk, inability to sit for long periods of time. Sometimes, when they've sat in an aircraft or they sit in a car for a longer period of time, or if they've sat in a movie, then it is very difficult for them to get up and walk. So, this is difficulty to walk, continuous pain, not just while walking, but also while resting, also while sleeping. They sometimes say, I have pain when I turn in the night, that leads to loss of sleep. So many problems that happen. They sometimes rock. This is what the patient comes to me with. Then what I see, what the signs are about crooked knees. If I press on the knee, they will feel a lot of pain. They will want to withdraw their knee. And sometimes these patients will not be able to move their legs completely also. For example, their knee will not become straight. It will remain with a few degrees of deformity, it will not become straight. And when they try and bend it, it will not bend further than, say, sometimes or 60 or 70 degrees. So this is what we call as deformity, not just that the knee is crooked in that straight plane also, so they work like that. When we see the x-rays, we showed you what happens on the x-rays. But what I mean to say from this slide is that pain is the problem that the patient faces, but we also see that deformity is leading to a lot of problem. And correction of deformity as such is an integral part of joint replacement surgery. This is a special x-ray. This x-ray is taken all the way from the pelvis, that is the hips, and all the way till the ankle. There is something called as a mechanical axis of the lower limb, and that passes through the center of the knee. What it means is this is the ball of the hip, this is the center of the ankle. So sometimes, if we drop a line from the center of the hip all the way to the center of the ankle, it automatically, naturally passes through the center of the knee. This is what has been given by Him. This is what has been given by God. This is the greatness of the human body, that if you draw this straight line, it will go through the center of the knee. But look at this x ray on the other side. This is an x ray of a patient with an arthritic knee. If we think this is the yellow line, which is that straight line connecting the hip and the ankle, and if you see it falls far away from the knee, no, the correct thing is that the knee falls far away from that central mechanical axis. And if you see this red line, this is the angle which this line forms. If it were to pass through the knee, it is probably a whopping 20 degrees. So this patient's knee is crooked. He has or she has 20 degrees deformity, and that is what we need to see. Sometimes in some patients, we will see more than 30 degrees deformity also. So deformity correction, like I said, is an integral part of knee replacement surgery, because when we correct deformity, the leg becomes absolutely straight, and I'll come to that later. And because of that, many things improve. Let us look at these videos. This is a lady before surgery. See how she walks. Look at her left knee. It is so crooked. She's bent. She's not being able to walk. So, wow, look at the deformity in that knee. That knee, the left knee, her left knee is really crooked. Because of that, her foot is flat. Because of that, her leg is unstraight. She's limping. She's almost walking like a duck. It's very difficult for her to get about her daily routine. Now, after we took her through robotic knee replacement surgery, look how she's walking. This is within 20 days of surgery. She's walking straight. She's walking so confidently. Look at that left knee now. Look at that. It's absolutely straight. That's the reason why we say that deformity correction, when we make that knee absolutely straight, walking becomes much better. The energy which they use to walk is also much better. Let me take you through a small, simple video of what we actually do in knee replacement surgery. When we say knee replacement surgery, it does not mean that we are going to totally change the knee. The knee has 3 bones in it, but that does not mean we are going to change the knee. We are only going to change the surfaces that are not doing well. So we resurface the arthritic articulating surface of the knee and instill artificial implants over there, such that that dirty cartilage is gone. Then we have a fresh articulating surface over there, and that leads to relief from pain. This is a small video on what we do. Please look at this video. These are the 3 bones of the knee. That's the worn off articular surface, cartilage. These are the components that we use in knee replacement surgery. Combination of metal and polyethylene. We only take off part of the knee which is not doing well, the surface. The bones remain the patient's bones only. And look how beautifully it moves now. Resurfacing of the knees takes away pain immediately. Because if a surface is not doing well, and my engineering friends and my friends from the mechanical background would understand that if the bearing surface is not good, it is going to cause a problem in whichever simple machine, whichever joint it is. It could be in the electronics realm, it could be in the mechanical realm, or it could be in the body. The knee is a joint. If the surfaces are not smooth, it is going to cause a problem. So we are going to resurface those not functional surfaces. But is it enough? No. Time and again, it has been proven right since the inception of the concept of knee replacement surgery, which was in early 70s and 80s. At that time, certain international authors uh, published a lot of details about the fact that just resurfacing the knee is not important. It is also important to correct deformity. We are saying this again and again because we are going to come to how we correct that deformity using a robot. So in 1994, they published, they reinforced that in 2008 when they said, yes, we are still correct. Deformity correction is very important, not just change of surface. And not up until 2024, we definitely feel the same. So over a realm of 40, 50 years, we seem to think that just changing the surface and leaving the deformity be is a problem. So we are going to change the surface and we are going to correct deformity also. So robots came into India a couple of years ago. I trained in robotic surgery in South Korea back in 2014. They were a more advanced nation and we had a lot of access to this technology at that time over there. Till now we used to use conventional instruments. So we would do this diagram. This is a diagram of how we open the knee. Then we drill into the thigh bone over here. Look at this. We drill into the thigh bone, open up the canal, put in a rod through the canal, use a lot of these various severe instruments, and then take accurate cuts, try and take accurate cuts such that we can then replace the knee. I want you to keep a particular attention on this diagram. See, here we are using some sort of a medullary, extra medullary jig, which means that this rod stays outside of the bone. We assume the bone to be here and we make sure that the cut is correct. The part which we need to cut so that we're going to change that surface. This is how we used to do this conventionally. Let me put one more interlude to this. It is very important that we do something called as gap balancing. Now you'll need to imagine this a little. This is a diagram of the knee, wherein this is the thigh bone, this is the leg bone, thigh bone, leg bone. Here the knee is bent, it is in flexion, whereas here the knee is straight. After we have done these cuts, we need to make sure that this gap, see this rectangular gap here and this rectangular gap here are the same. If it is, if these gaps are the same, then you can do the math. When the implant moves, it is going to move over a beautiful surface with equivalent gaps on both sides, and it is going to move very, very well. So gap balancing, which is a more technical part of knee replacement, is very, very essential. And I'm going to connect the dots here later when I say that the gap balancing is done very, very well by robot. That's what we are going to do. See, look at this diagram. This is an X-ray of an arthritic knee where you have a line going right from the center till the ankle. The knee is far out. How do we restore this to nearly as good as what the Uparwala has given? Which means that the knee should go through the center. We use a combination of perfect cuts and a combination of gap balancing to finally achieve this. Now, after surgery, this is a knee implant in place as seen through the X-ray. Look at this, the center of the hip, center of the ankle, dead center of the knee. See, this is what we need to achieve. What does the robot do? Till now, we did not have robots. Now we do. What does the robot do? See, we used to use these big conventional instruments where there used to be a rod going through the femur and a cutting guide and such. And now what we do is that we use the robot. The robot, what it does is, and our robot is a non-CT dependent robot. The robot collects points on the knee live during surgery. It forms an artificial model of the knee in its AI. Once this is formed, it tells us how to do the cuts accurately. There is no need for these extramedullary rods. There is no need for all of these things, which sometimes make the surgery a little complex. and not depend worthy. It's going to be here. There are two screens. They're going to make these cuts, and the implant is going to go fancily onto those cuts. That is the advantage of the robot. Let me let me indulge a humorous side over here. Let me ask our audience, suppose if I were to ask you, what is 15 twos are? The answer comes very easily, correct? It's 30. Suppose I ask, what is 500 twos are? The answer comes pat, it's 1000, right? Suppose if I ask, what is 15,523 27s are? It's there on the screen. What if I ask this question? We will have to think about it, most of us. In fact, the whole lot of us will have to think about this, probably calculate, take a pen and paper, do 7 threes, etc., etc. Suppose if I tell this lady, this young lady who is probably in sixth or seventh standard of school, suppose if we tell her to give the answer and she gives you a pat answer, this is the answer immediately, will you trust her? Yes, you will. But then you will say that it is possible that she already knew the answer, or she was prompted, or she's just a whiz kid. Suppose if I tell this lady, this lady is one of the best mathematicians that our country has ever known. She's Shakuntala Devi ji. Suppose if she gives you a pat answer, will you accept it? Yes, you will, because she's a scholar. She is the best there is, and of course she knows this answer and should come very easily to her. But if I tell the world's most powerful supercomputer to give you this answer and pat comes the answer, there is no question about it. It is a supercomputer. Its job is to compute, and its job is to be accurate every time and very, very correct every time. Similarly, in joint replacement surgery, if I use the conventional instruments and try and achieve accuracy, I have to be very, 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 very good, or I have to be lucky. Say a good surgeon does it. Say a good surgeon with a lot of experience who has done thousands and thousands of cases. Suppose if this sort of a surgeon does and says that, yes, I can achieve very good alignment, yes, it is quite possible. But suppose if I tell the robot to help me with it, if the robot does it, can you trust the results? Yes, damned right you can. And look at it, it's already giving you an answer. It's 4,19,000 and odd. Will you trust this? Yes, of course, because it's the job of a robot, of a computer, of an artificial intelligence, or of a calculator to give you calculations, and you will trust this result. Correct. So, welcome the next generation of robots. If you were thinking, what does the robot actually do and how do we do this surgery? Here's a small representational video. Look at this.
When preparing for a knee replacement surgery, you may be interested in learning how advanced technology will be used in your procedure. DePuy Synthes, a leader in orthopedics, offers the VELYS robotic-assisted solution designed for digital precision in knee replacement to help you start moving again. Let's take a closer look at how the technology works. The system includes a robotic-assisted device, a high-speed camera, optical trackers, and data screens designed to help surgeons achieve the highest possible precision level. With the VELYS robotic-assisted solution, surgeons are in control during the entire procedure. The device does not move or operate on its own. Your surgeon will start the procedure by making an incision in your knee. Next, they attach trackers to your knee, which work with the camera to gain the information needed to perform your procedure. From this information, the surgeon creates a 3D model of your knee. Your surgeon will move your leg back and forth to test the function of your knee. This will help assess your full leg alignment and soft tissue tension. During your procedure, your surgeon continually gathers data related to your knee to help them perform a precise knee replacement surgery personalized to your specific anatomy. This process helps your surgeon optimize the outcome with the use of data that's unique to you. Designed for precision, this advanced technology can help your surgeon visualize and predict the stability of your knee joint, find a favorable implant fit, and perform a highly accurate knee restoration. To restore your knee, the surgeon guides the robotic device to remove the damaged bone and cartilage in your knee, making sure it matches the surgical plan. The technology software is used to verify your final alignment and balance. The implant components are placed, and your surgeon will check the range of motion. Then your surgeon will remove the trackers and close the incision site. After the surgery is complete, your care team will work with you on developing a post-surgery recovery plan. For more information,
That's it. Do you think this is magic? No, it is technology. It is robotics. But a couple of decades ago, it would have been thought to be magic, and we are there now. In today, in today's time, in today's world, we are performing, we're getting to perform magic of couple of decades ago, and that's what technology is all about. Now look at this. This is an example of one of our patients. Uh, she had a whopping 23 degrees and a 27 degrees deformity on both sides. She's a little heavy set as well. And this picture has been taken when we did her first surgery of the right knee. And look at the beautiful movement that she's getting. She's getting a full flexion. And in fact, she can literally sit on the ground also, although we advise not to. This is an image from the computer screen of the robot. If you see, here there is a blue line and here there is a red line. And these are too far apart. These are 9, 4, 12, and 8. These are the gaps that they are showing. When we use robotics, we get live data during surgery as to what is happening over here. You remember, if you take your Mercedes car to the cleaners, they will put in a laptop and they will assess your car, and they will understand a lot of details from your car because it's being seen on the screen and it is very accurate. Similarly, we use robots and it gives us lifetime data of what's happening into your knee after we've gone through the surgery, after we've done the balancing, after we've replaced. It shows us a final picture. Look at this. Look at these two lines here. And look at this line. It is going absolutely straight center, 1 millimeter, zero point 0.5 millimeter, 1 millimeter, 1.5 millimeter, and zero point 0.5 millimeter. You know how small 0.5 millimeter is? You probably cannot see it on your book also. That is how accurate it comes. That is how accurate it gets. That is how we get this final X-ray. And that is how we get an happy patient who, after having done both her knees, went to her jatra, which was about 350 steps. She took those steps. She was happy. She got prasad for me and the team as well. So this is the beauty. Beautiful alignment, beautiful gap balancing, very accurate. And why are we harping so much on accuracy? I'll come to that point later. Are the results better with the robot? A lot of patients ask me, Doctor, you've been doing this surgery for so many decades now. And initially there were no robots. You used to do it with hand. I said, yes, that is true. Then why the robot now? Look at all these publications from international journals. This is from 2022. This is from 2022 December. And this is from as early as 2025 January. All of them have conclusively said that robotic surgery leads to better accuracy. Look at this: improved patient satisfaction, faster independent ambulation, associated with improved patient satisfaction, ability to control implant position, ligament balance, limb alignment, leading to increased prosthesis survivorship. Leading to increased prosthesis survivorship means longevity of the implant. Many patients come to me and ask me first thing, Doctor, kitna chalega? Ketlu chalse? How long will it benefit me? Because conventionally it was thought that these implants don't do well for a very long period of time, and eventually you have to undergo revision surgery. So this is a very important question, and they used to wait long years, sometimes suffer pain for 8, 10, 15 years because they thought if they do it early, then it's not going to last too long. Things have changed. Robots are here. Alignment is better. Accuracy is as good as it gets, and therefore increased prosthesis survivorship, therefore longevity of the implant, long lasting benefits. Let us talk about list of benefits here. Precision and accuracy. We've explained how the accuracy can come to within millimeters, within half a millimeter of what it should be. That is how accurate it can get. Consistency. Somebody I know very well, and I will tell you, it is my father who used to always tell me, Pranav, the greatness comes when you get it right the first time, every time. He used to say this: first time, every time. That is what consistency means. Every time we can get the same precision, the same accuracy, because we use technology, because we use computer. Let's talk about consistency in another way. There was once upon a time they used to make something called as a Ford Model T. That was the first car to have been made. They used to handcraft it. They used to hit the patra. They used to smoothen it, paint it, and they used to make it. And every Ford Model T used to look unequal with each other. It used to look different. It used to be very clear to say ये फोर्ड मॉडल टी गुप्ता साहब का है, क्योंकि उसमें वो पिछला वाला जो पार्ट है वो बराबर नहीं है. Because it used to be made by hand. There was no consistency. Now, if you look at, say, the erstwhile Maruti 800, okay, very, very popular car, biggest revolution in India. All Maruti 800s used to look the same, behave the same, problem the same, correction the same, everything, because it was made on an assembly line by an industrial robot. Look at here. Technology leads to precision and accuracy every time, consistency. That's what consistency is all about. Minimal trauma, which means that if we are not going to perforate that femoral canal, it is going to bleed less. We are going to open the tissues less, because we don't need to see very exactly what has happened because of by our eyes, because we are seeing everything on the computer screen. It is giving us live continuous feed as to what's happening inside the knee. So minimal trauma, higher safety. We know that these robots are very, very consistent. These robots are very, very sharp and accurate and safe as well. They will not unnecessarily perforate tissues and cause injuries and such, which is humanly possible. Faster recovery. We understood this. Why? Because when the limb is absolutely straight, really straight, when the gaps are beautifully balanced, the patient is going to be able to bend the knee very well. Very next day, they're going to be able to stand because the knee is balanced. It is not rocky, unstable. Therefore, the patients are going to have faster recovery, shorter rehabilitation. I've seen patients walk to the washroom very next day and they say, doc, now let me go home because I'm already walking to the washroom. Why do you want to keep me in the hospital? So the faster rehabilitation, better flexibility, because the patient is going to have very good gap balancing in extension and in flexion. Therefore, if the gap is balanced, the knee is moving so smoothly, flawless. The robot is surgeon controlled, it is not surgeon dependent. So what happens is, um, this is unlike an industrial robot wherein you put in, you feed in a certain parameter and the robot goes and does its thing. No, it's not like that. Here it is surgeon controlled. All these parameters are shown to the surgeon and suggested, and the surgeon takes the final decisions. Finally, it is a robot and we are the surgeon. Advanced instrumentation is very good, helps us cut less, helps us do better. Longer life of implant. This is the most important thing. When your knee is absolutely aligned, when the knee is absolutely balanced, directly proportional to longer life of implant, longer lasting surgery, more years of benefit to the patient. Use in complex cases. See, sometimes we have patients who have very crooked bones of the femur. The thigh bone is only very crooked. Sometimes we have a patient who has had say, a thigh bone fracture in the past, and there is a long rod inside the thigh bone. When these patients used to require knee replacement surgery, initially we used to have to remove that rod from the femur first as a primary surgery. Then we used to revisit for knee replacement surgery because that original implant used to go with a rod inside the thigh. Now that is not there. The robot actually does that automatically. So we don't need to remove that rod. And therefore, it is much, much better. The center of rotation of the hip, the center of movement of the knee, the center of ankle, everything is mapped by the robot. Very easy, used in complex cases where more mistakes would happen, but it's all avoided because there is a robot. Let's discuss some misconceptions about robotics. Many patients, these are the things that we come across very frequently, which we are asked frequently, which patients worry about frequently. Things like costs are through the roof. Many cannot afford. It is a normal thought that robotic surgery and use of robotic surgery is more expensive. It's not. It's not really more expensive. than your average surgery. For example, suppose if your average surgery used to cost you, say, an arbitrary figure, say 3 lakh rupees. Now, if we use the consumables of the robot, it would be about 50 to 60,000 rupees extra. If you look at how much you're going to pay, say 3 lakh rupees, and if you have a 50 to 60,000 rupees extra, that's not more than 20% more than what your basic cost is. Suppose this, because of the use of robotics, because of use of technology, suppose this implant lasts you 20, 25 years, then that 20% extra divided over 20 years comes to nothing when you're going to be able to pay 3 lakhs anyways. So robotic surgery in itself is not more expensive than primary surgery without robot. The good part is that both of or three of my good hospitals, the robot is owned by the institution. So the robot is not charged, only the consumables are charged. So this technology is available free of cost. So in fact, there is hardly anything more that goes into the costs of robotic surgery. Some people say there is no blood loss in robotic surgery at all, and it is not their problem. They may have read up something on internet and such. No, that is not true. There is blood loss in surgery, but we do not invade the femoral canal. We do not do a big cut, so the blood loss is less in robotic surgery. It is not that it is not there. There is blood loss in any sort of surgery. Acha, another thing, let me jump to this point. Robotic surgery is laser surgery. People feel that it means it's laser surgery, and in better terms of the word, it is arthroscopic surgery. No, it is not. Robotic surgery means we use the robot. We showed you a video of how it works. I specialize in arthroscopic surgeries as well. I do all these ligament reconstructions where it is keyhole surgery, but that is not available in the realm of total knee replacement today. So that is a misconception. It is not arthroscopic surgery. Therefore, there will be a cut, there will be some blood loss, and there will be some recovery from these changes. सर्जन ओनली चार्जेस रोबोट एक्चुअली ऑपरेट्स जब सर्जन चार्ज कर रहे हैं रोबोट ऑपरेट कर रहे हैं तो सर्जन क्यों चार्ज ले रहे हैं दैट इज it's logical but no the robot is not completely independent. In fact, when I was doing a research fellowship back in South Korea, one of the important tasks that I was doing along with the engineers of the university was to make the robot more surgeon dependent. So the robot is a very highly specific machine. It gathers data, it computes data, it gives me very high accuracy of data sharing. When I select that data, it gives me the accuracy of executing it. The robot is not independent, it does not do everything itself, it does not do anything itself. It does only in the guidance of the surgeon. So the surgeon is operating, surgeon is in control, and the robot is not going to suddenly run amok and do whatever nonsense people think that it could do. No, it's not true. Insurance does not cover robotic surgery. When robotic surgery began in our country, some of the insurances did not know about this, and they always did not give the full compensation for robotic instruments and this thing. But nowadays, most insurance companies have likened to the concept that robotic surgery is here. It's here to stay. It is giving much better results, and they are accepting this much better. Many of my patients have not had any problem in claiming insurance after robotic surgery. So that is also a myth. Look at this last point. Mine is a simple surgery. सिंपल तो करना है आपको क्यों बड़े बड़ी फैंसी स्टफ यूज करने की जरूरत है नहीं ऐसा नहीं है सिंपल स्टफ कैन ऑल्सो बी डन with very good technique. Why are we worried about just because it is simple? Should we not use a better technique? We should. We absolutely should. For example, suppose you have a Sancheka ice cream versus you have ice cream of, say, uh, some of the best Italian brands. They have a ready-made mix, they have a dispenser, they have a lovely cone, and they'll make that. It looks good. Ice cream is the same, but it still looks good. It feels good. It tastes good. The mixture, the emulsion is always correct because it is made by technology. That's the reason why we should use it in simple technology as well. Now, having said this, let me quote Daniel Wilson. There are endless number of things to discover about robotics. A lot of it is just too fantastic for people to believe. And I'd like to thank everybody here for being such an attentive audience and wanting to learn about the realm of robotic surgery, what we can achieve through it, and what it actually means. I'd like to thank Denosumab division of Intas Pharma to be able to bring me closer to so many people who might be watching this. Thank you, Dr. Kajal from Intas Pharma. And I think we should continue this line of educative talks such that people would be aware of what's happening in the realm of technology and surgery and take benefit of it.
Thank you, sir, for your kind words. And it was a lovely, lucid presentation explained in a very easy manner, relatable examples. So, thank you so much for sharing about this very,
Thank you.
yeah. So, sir, there are a few questions from our audience. One of the
Yes,
questions, if you
certainly.
can address, yeah.
Yes,
So,
certainly.
is physical therapy different after robotic surgery when compared to traditional surgery?
Physical therapy,
Or physiotherapy, that's it, what this is.
physiotherapy. Yes,
Yeah, yeah,
absolutely. See, the
yeah.
knee is a joint. We are going to change some components of the knee. And in our hands, physical therapy, physiotherapy is aimed at one, trying to alleviate pain, overcome pain, which mild pain which might be there after surgery. These days, we are very good at control and management of pain also. We are probably in the golden era of joint replacement on orthopedic surgery. So we manage pain very well. And in fact, let me give you the example of this young executive, vice president of a big corporate company. She was relatively young when we did her knee surgery. She must have been 55 or something. And at that time, after 8 days of surgery, she called me one time, 11:30 in the night, and said, "Doc, I have to speak with you right now." Usually, when a patient calls up that late, we worry, what happened? Fever to nahi aaya, gir to nahi gaye, kuch to nahi ho gaya.
Right, sir.
He says,
Right,
"Doc,
right.
I have to speak to you right now because my relatives are behind my back to call you right now." I said, "Yes, please go ahead. What's wrong?" Say, "I'm
Right,
not having any pain. I'm not having any pain. Is that normal?" I said, "Yes,
right.
of course, it's normal. Don't worry. Go back to sleep. It's okay." So, physical therapy, apart with everything, is aimed at alleviating pain, restoring motion. And in our hands, we teach a couple of exercises. These the patients do at home. Usually, they do not require continuous aggressive physiotherapy. And within a few days, we in fact encourage them to go back to routine. In fact, set out. And I have images of people who've undergone both knee replacement, and they're happily sending me an image of them sitting on a scooter and going to meet their clients within 1 month of surgery, going to their native places, traveling, and such. So, this is when done correctly, when done accurately, when done with robotics, patients are very, very happy with the outcomes. And physical therapy, physiotherapy is never a focus for us. It is
Yes,
means to achieve some amount of movement, to achieve to overcome pain. These are the things that we use physical therapy for.
right, sir. Thank you so much,
But
sir.
so to answer
Yeah,
the question of our viewer,
yes, yes.
robotics, the most important thing is accuracy, alignment, and good recovery. Physiotherapy is not the most important thing in the realm of joint replacement surgery.
Very rightly said, sir. So,
Mm.
sir, there is another question. How soon can I walk or return to work after the procedure?
You can walk within 6 hours of surgery.
Okay.
You can walk within 6 hours of surgery. In our hands, we usually help the patient walk the very next morning after surgery. There is a gentleman in New Zealand who believes in something called as fast track TKR. What he means is that the minute the patient undergoes surgery, within 4 hours, the patient is sent home. But
Wow.
this is a Western country, and here the patient is met by a very qualified nurse and a very qualified people who can help them at home. Here, we generally make sure that the patient is able to at least go to the washroom and climb a couple of stairs before they can go back home. So we take about 2 days. Patient usually walks very next day after surgery. By the second day of surgery, they are happily going by themselves to the washroom. We usually send them home in 3 to 4 days. We do recommend that patient take a little bit of rest, couple of days for the wounds to heal, to get better. And then we allow them to go back to work. Yeah, within 15-20 days, they are back to work.
Wow.
Yeah.
Very nice, sir. Yeah. Because that is an apprehension, especially if someone is already, is in pre-retirement phase and they have trouble, so they want to join their jobs quickly. So
Yes,
that's
and
fair. Yes. Yeah.
some of our patients within a month's time will probably get into public modes of transport and safely reach their offices. And they'll come and proudly say, "मैं जाता हूँ, घर से निकलता हूँ. I go into the bus, then I climb up the stairs, go to the train, then go all the way to church gate. then climb up and go again. And then I do, doc, I clock 6,000 steps. I said, I
Wow.
don't clock 6,000 steps in a year's time. You are doing it in a day's time. So patients go back to their routine and they're very happy with it. Yes, they're pain
Yes.
free, legs are straight, they're walking with very less effort than what they used to. So good, 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 all the way good.
Right, sir. So,
Mm.
sir, though you have already covered it in your slides, but there is are there any special set of patients which should opt for robotic surgery, or it is perfect modus operandi for all?
Kajal, madam,
Yeah,
suppose I were to ask you 15,237
yeah, yeah, yes,
27s
sir.
are correct.
Yes, right,
Now,
right, sir.
suppose you were on a desk. I
Yeah,
asked you this question, and you have a pen and paper, and you have a calculator.
of
Which
course.
one would you use?
Calculator. Yes, yeah, yeah. So, right, sir.
Why would you use a pen and paper when there is a
Yes,
calculator? Suppose I were the asking person, and I
yeah.
wanted a true answer. What would I want you to use?
Perfect.
I would want you to use a calculator.
Be
Yes.
more accurate and precise. Right.
Yes, yes,
Yes,
by all means. So always, always, yes. If I had the option, I would use a robotic surgery for every case. Yes, why not? Why
yes.
not? Yes.
Yes. So to further add to this question, see, osteoarthritis is a chronic issue
Mm,
where it starts very early on, and generally patients come to the OPD very late
mm,
when it's already quite worse.
mm,
So if you could guide our patients, like when is the right time to go to the doctor, like
mm.
when they can judge on their own that now is the time to go to the doctor and get myself treated.
Let me explain this to you in
Yeah.
two or three parts.
Yeah.
Osteoarthritis is age-related degeneration of the cartilage of the knee. We explained this.
Yes, sir.
It is there in my knees, in your knees, and all our viewers' knees.
Yes.
When it starts giving the problem is the question. When will it start hurting you enough? When will it start taking you away from your routine? I always give this example. For example, there are some ladies who have been in pain for a while. They come to me saying, "Ke, it's okay, pain is there, but I can manage it." That's when I tell them that slowly it will happen and you will not be
Yes.
able to see it. That there will come a time when you will stop going to social occasions. They will say, भाभी जी पहले आते थे, अभी वो नहीं आते, कम आना चालू कर दिया है, वो अभी मैरिज में भी नहीं आते हैं, वो बच्चे की पार्टी है तो डेफिनेटली नहीं आएंगे. शी इज इन अ लॉट ऑफ पेन. Slowly, they will stop going to the market. Slowly, they will stop being able to get up from their sofa to get a remote control for the TV. That stage should not come because
Yep.
we want to have good quality of life. So, when there is pain, when there is deformity, what I would say is meet your doctor. Meet your
Right.
doctor, meet me. Feel free to talk, come over just if it is information. There are various ways to treat the knee. All knee problems don't end in robotic surgery. Robotic surgery is chosen for certain problems where we can assure that this problem will be benefited from robotic surgery. So
Right.
that's when we use technology in other forms. So we can start from giving simple medications and physiotherapy. We have some injectable options, and then last resort, when it is not working, when the deformity is quite a lot, when the pain is quite a lot, patient is quite troubled, that's when we do surgery and they recover very, very well. So,
Right, sir.
if there is pain, if there is deformity, if you're feeling it difficult to walk, difficult to get up from a sofa, if you sat in a car for 2 hours, then it takes 2 minutes for you to get adjusted. If you're turning in the night and you still have pain, that's when you need to see your orthopedic surgeon,
Right,
joint
sir.
replacement
And
surgeon.
sooner the better. Sooner the better. We should
Always
not.
sooner the better. I also give one more example. Suppose if you started having pain when you are 60, and the conventional line of thought was that the implant lasts only for 10 or 15 years. So you say कि नहीं मैं और 10 साल चलाता हूँ. I'll see the doctor after 10 years, 70. So then I will have 10, 15 years, उतना implant चल जाएगा. But the
Right.
fact is that at 60,
Yes.
children are married, they
Yes.
are self sufficient. Your duty towards work and everything is over. You want to travel, you want to go for tours, you want to go to social occasions, you want to dance on your grandchildren's birthday parties. If you don't get this sorted at 60 and wait till 70, then 10 years you've spent
Yes.
in pain. And
Pain. Yes.
eventually, after that, you don't want to do these things. You might not be able to do these things for different reasons. So I think it's better that
Right.
you early check it and early get it done. Early take relief.
Right. Yes. Yes. Right. So accurate option at the right time. So that's the
Yes,
right way to go
absolutely.
about it. So,
No,
sir, there is
accuracy
one
is
last.
given because we will use the
Yes.
technology.
Yes. Yes. So there is one last question. So this is from one of our patients, that what should I do to ensure the best outcome from robotic surgery? Are there any precautions or special investigations that are prescribed by you, or any precautions?
In terms of getting a good outcome from robotic surgery, you just as a patient, you
Yes.
just need to make the choice. You need to
Okay.
make the choice to go in for robotic surgery. Most surgeons who use the robots are very well trained in joint replacement, and now they have further specialized into use of technology, joint replacement. For example, I already knew how to calculate 15,000 blah blah into 27. But now
Yes.
that I have a calculator, I'm not spending more time. In fact, I'm assuring consistency. So, in terms of what should the patient do, not really much. Make a good choice. Use robotic surgery. Go to your correct surgeon. Come to us, talk to us, and we will guide you as to what needs to be done. There's no particular thing that you need to do. Come in
Right.
time. We can help you better.
Right. So that's also the other. I think actually there were a lot of questions, but most of the things you have already covered. I
Mm.
requested few questions from you, so that it would help our patients further. So
Absolutely.
thank you so much, sir, for sparing your time and enlightening us on this topic, which will be, I think, helpful to most of us, especially at this age. I'm talking about myself also. Also, my mother is around 70 years old, suffering with osteoarthritis. So I also got confidence in
You're
robotics.
welcome to come
Yeah,
back and we will
yeah,
help her, we
yeah,
will guide her. Just
yeah,
because you come to the surgeon does not mean you need to get operated. You can come for
yeah.
information as well.
Right, right. Very rightly said, sir. So thank you again from Intas Pharma and BoneFit Life, and looking forward to more such interactions where you can teach us more about all the relevant topics in
Through you,
orthopedics.
Dr. Kajal, I would like to thank Intas Pharma for setting up this occasion, for making me able to reach out to a big audience. Yes, we stay committed to care of technology, to use of technology in patient care, and we also stay committed to a lot of social service through our Rotary organization. So we try and stay committed to the health of community. My contact details and everything is available on this site, and I'm reachable through a lot of social medium and website and everything as well. Feel free to talk, ask questions, post questions, and I will find the time to answer. And if the time is right and if God is willing, then I will help you through your pain as well. Thank you, Dr.
Okay.
Kajal. Thank you so much.
Thank you,
Have
sir.
a
Thank
good
you.
day. Bye
Have a
bye.
good day.
You too.
We are offline now, sir.
We are offline.
Yes, sir.
Yes, sir.
Recording has
Thank you,
stopped.
sir. Thank you, sir. It was a wonderful, wonderful
Thank you, Dr. Kajal.
discussion.
Thank you.
Yeah.